It's no secret the oil industry runs the basin's economy, but several struggles various businesses face during the bust are seen from the outside.
Anita McDowell gives us a look inside the world of nursing after 40 years of working in the business through several booms and busts. Don Locke has the story.
We boomed. It was good, and then I think it dropped off in the 80s, and then it kind of stabilized, and then it came back up, and it's gone back down.
The roller coaster of the oil industry rocking businesses across the basin. Anita McDowell has been a devoted nurse for 40 years, and she tells us she's seen the good, the bad, and the ugly as the economy evolves.
In the 80s, you know, Friday night and Saturday night, you came into the unit. The next day, you knew you had the gunshot wounds and stab wounds.
She says during the bust, field workers flooding the ER and forcing them to stay more alert for their safety.
During that time, so you tighten up security and things like that.
The good news is, even when the economy falls, McDowell says the hospital's staying just as busy. The bad news, Chief Nursing Officer Chad Donovan tells us that's when the area loses several hands they need on deck.
With having the bust, it's really even hurt us even worse, I think, because these husbands or people that are working in the oil field can't find a job at all here, so they're having to leave the area, which is also taking the nurses away.
Odessa College's Associate Dean of Nursing, Marie Vasquez Brooks, says the Texas Workforce Commission hopes nursing will reach a 28% growth before 2022 to combat the current lack of registered nurses needed in the area.
Did you work beforehand?
26 and a half.
26.
But one basin nurse who always sticks around is Anita, who says even during these shortages, the hospital does what they can to cover their ground.
On top of an already impressive nursing career and working through several oil booms and busts, Anita gives about 1,000 flu shots a year, and that's been over the last 20 years. I'll let you do the math.
Director of Community Health Diana Ruiz says shortages or not, healthcare providers do whatever they can during changing economic times to take care of patients.
I think it impacts us because ultimately we want to provide the best quality care possible for our community, and we can't necessarily do that if we don't have enough great nurses providing daily care to our patients.
Making it that much more important to have experience like McDowell's on board. And after decades of experience, patience, and priceless memories in the hospital, she doesn't have plans of leaving anytime soon.
I always say I'm going to be like Forrest Gump and say, I'm done one day.
Dawn Log, Local 2 News.